4% of adults 18 and older, 63.8% of adults 18 and older, and the New York Times has this greater than 99% 65 and older, which has us #1 in the country. So the place where we're lagging is we're 19th, third among the top most popular, the 10 most populous states in terms of fully vaccinated, in terms of the total population, and I think where we're lagging is probably in the younger generation. But the vaccines really work, and you can see this in the hospitalization numbers. Like the rest of the country, Pennsylvania has increased the number of cases, but we are actually one of the best states, I think third from the best in terms of the overall rate of cases per 100,000 over the last 14 days. So that moving average is, I think, is important. If you look at any one day, Tuesday is usually a pretty bad day, but if you look at the 14-day average, we're at 12 cases per 100,000. The U.S. is at 38, and I think you look at some of the states like Louisiana, I think they're over 100 per 100,000. So we're in good shape there. Hospitalization, we're at 7. The national rate is 19 per 100,000. But again, we were just talking about this inside. Pennsylvania also has a pretty high capacity. We have a lot of hospitals and a lot of healthcare facilities, so our capacity is pretty high. But even without taking that into account, we're 10th in the nation, I think, in terms of hospitalization rates, and all time we're also one of the lowest. So there's my bragging for where we are. The point, though, today is that as good as we're doing, as well as we're doing, it's not good enough. That with the vaccine, we actually have the ability to do even better. And this is not where we want to be, again, as good as it is. But every one of us lives in communities where we have vulnerable populations, people who are at greater risk from more dangerous and more contagious variants of the COVID-19, like the Delta variant. Right now, that risk is increasing as these variants spread across the nation. And again, we're not in the hot spot, but we have no reason to be complacent. We've got to keep working. Is that rain? It's just right on me. So I spoke last Friday about, I'll go fast here. I'll speak how the vaccines actually, what's going on here? So talked about how this was kind of unexpected. Yeah, why don't we do you have an umbrella? You all right? Okay. Anyway, the idea is that last Friday talked about how we can slow the spread of vaccines. We have the ability to do this just by getting vaccinated. That was true ever since the vaccine came out, and certainly true now that the supply and the demand are in sync with each other. And it's why in Pennsylvania we're trying to make sure that we keep everyone safe by getting the vaccine. It's the right thing to do. If you live in any community with anybody who's vulnerable, you're a shield. Only if you get vaccinated. If you don't choose to be vaccinated, you're not going to serve as a shield, and you're putting the people around you, your neighbors, your family members, your friends, your community at risk. So on September 7th, we're going to start with those facilities that the Commonwealth owns that are congregate care facilities, like the veterans' homes, and there are a bunch of others that we will be giving employees there the choice. Either get a vaccine or you're going to have to be tested. And that's the choice that they're going to start on the 7th of September. Starting October 1st, all employees of the Commonwealth will be given an incentive to get a vaccine. We'll give you a day off. That's pretty good. Get a day off if you get the vaccine. And we'll ask you to attest that you've gotten it. And then that starts October 1st. We want to reward those who have already gotten the vaccine and encourage those who have not yet decided to get the vaccine to get the vaccine. We just need to do this kind of thing to get more people to do the right thing. Get the vaccine. Be the shield we need you to be to make Pennsylvanians safe. And we've got to do this kind of thing. States around us are doing all kinds of things like this, and I think it's the right thing for us to do, especially for those who depend on the Commonwealth and the Commonwealth employees to keep them safe. So businesses are doing this, other states are doing this, and I think it's the right thing to do. Everybody wants to make sure we do everything we can. This is getting heavy. everything we can to keep people safe in the facilities that the Commonwealth operates. So now it's my pleasure to turn this over to the good doctor who's going to talk about this. And you didn't bring your umbrella either, I see. Okay.
That's all right. We'll make it work. It's a first for me, so we'll make it work. Good afternoon, everybody. I'm Dr. Michael Rybczynski. I'm the Chief Clinical Officer at Penn Medicine, Lancaster General Health. My healthcare colleagues and I applaud the governor, as well as the Commonwealth of Pennsylvania, for joining Penn Medicine and a growing list of public and private employers in keeping our community safe by requiring COVID-19 vaccinations of its employees. The vaccines are the most valuable tools that we have to stop this pandemic. We have over 350 million doses administered in the United States, 4.5 billion almost administered worldwide. We know these vaccines are incredibly safe and highly effective at preventing severe illness and hospitalizations from COVID-19. As a family physician, I take great care of newborns to our frail and elderly in our community. And you should know that getting vaccinated helps protect every one of those patients. As each of us gets vaccinated, it helps everyone keep our communities safer. While social distancing and masking may help reduce the infection rates, reduce transmission, we know that vaccination remains of paramount importance. Vaccines are necessary to protect the vulnerable, the immunocompromised, and most notably, our children, who may be too young to be vaccinated and are about to go back to school. As a leader in one of our health systems, it's my growing concern that we have the Delta variant, which could increase our risk of transmitting COVID-19 and having increased hospitalizations. And it's those employers of any size, large and small, play an essential role in making sure that we can increase those vaccination rates and put the pandemic behind us. So certainly, I just want to say at the end, the American Medical Association, American Hospital Association have all supported vaccinations for their employees. And it's our Commonwealth and country are starting to experience that increased surge in COVID infections, hospitalizations, and deaths, with an average of almost 500 Americans dying every day. As the healthcare community has led the way in requiring vaccines for our employees, we encourage all the employers to join the Commonwealth in adopting policies to encourage vaccination. Fostering safe working conditions for our employees will ultimately keep our families safe and ensure healthier communities. Thank you.
So, as predicted, the rain is stopping just as the press conference is ending. Any questions? Yes.
Governor, it's very slightly off topic. You have $370 million in COVID ARP money that was put aside for your office. And have you made any plans on how to spend that money? This was part of the budget you signed, $370 million.
Well, yeah, we're actually working with it's not just me, it's with the caucuses, the Democratic caucuses in the Senate and the House too. So we're still working on how to do that.
Do you have, oh, sorry.
Well, no, and I mean, one of the things is the president obviously has suggested that we take $100 of that and make that an inducement for people to get the vaccines. And we were trying to do sort of a back of the envelope. That might take $80 million right there. So we still are working on how to get that out.
Are you interested in that sort of incentive program, using those money?
Yeah. I mean, I keep bragging about how good Pennsylvania has been without the incentives. Unlike some of the states around us, we haven't really done that. But yeah, I am interested, which is why I'm saying to employees of the Commonwealth, get a vaccine, I'll give you a day off.
Do you know how many people are affected by the incentives? The state-employed people.
Yeah, around 25,000, but
yeah.
The incentives for all employees. So that would be.
Yeah, how many are covered by those state incentives, and if you happen to know how many of them are unvaccinated? Do you have any perspective?
I don't know how many are unvaccinated, but we have about 72,000. There, okay, 72,000. Thank you. And I don't know how many are unvaccinated.
Governor, do you want to weigh in a little bit on schools and mask mandate? It's changing as the days
Yes.
go on and in our neighboring states. Where do you sit right now?
Right now, the Pennsylvania Department of Education is strongly, again, Pennsylvania is different from other states in that each of the school districts, they have their own governing boards and they have to make up their own minds. The State Department of Education is strongly recommending that they follow the CDC guidelines.
And also, as we're looking forward at this, how is Pennsylvania sitting? You mentioned nationwide a little bit, but we've seen a change from a high transmission rate to a moderate transmission rate, and that's changing a lot. How do you feel about how Pennsylvania is stacking up?
Well, as again, I feel over the course of the pandemic, we've done pretty well in a tough situation. Now we have the vaccine. I mean, a year and a half ago would have loved to have the vaccine. We have that now, and Pennsylvanians have responded really well to that. So we're doing really well now. That I think, not I think, it is the reason that we're doing so well in the case count. The high vaccination rate, if you look at the other states that are doing what we're doing, they're doing pretty well in the vaccine. The one that stands out that I don't quite understand is South Dakota, but the other ones like Vermont, Hawaii tend to be really good in terms of the new cases, and they're also have done very well when it comes to vaccines. So this is our strategy: get the vaccine, and you protect yourself. And basically, you set up this community shield that helps it. So far, whatever variant has come along, this vaccine works.
So you're putting this initiative in place to continue to push that, and I think that's the message we've had all along.
Yes.
Are there any demographics, any pockets of information short of just young people, and young people who maybe are not qualified yet, that vaccinated people can talk to and say, are you vaccinated? Why aren't you vaccinated? This is why I think you should get vaccinated.
Yes.
Should regular vaccinated Pennsylvanians also be advocates? What other initiatives can take place other than just the ones the state is pushing?
We are doing a lot. And in fact, we just had a bipartisan vaccine task force meeting this morning and talked about some of the things we're doing. We have been very aggressive in trying to say, how can we reach this? The first couple months was just a matter of supply, and people were lining up. Then we had to start dealing with the demand problem. So among the things we're doing is we have a lot more providers now than we did. We're working through family practice physicians and pediatricians, family practice right here, and we're also going out to smaller communities. We're trying to get influencers to go with certain demographics. We just talked this morning about making sure that we have people who are specifically attuned to the interests of younger folks. We are doing it in different communities that might be hesitant. I've made calls to Washington to say, can we even have smaller doses? I mean, one of the things was Pfizer went to bigger vials, trying to get smaller vials so that works better for family practice physicians and pediatricians who may not have tons of people coming in every hour, so that they can use what they have. So we're looking at all of those things to try to make sure that we're reaching everybody, and the incentives, I think, are also going to help.
The RC, it's your threshold?
I don't know what that you mean, like herd
No,
immunity.
We're going to get to this. The sociologist I think we're going to get to this amount of people. We're going to get it, and then we're just going to get it further.
Well, I would have thought, I mean, when we first started this back in December, January, we sort of had as a really goal that we didn't think we'd ever hit, of 80% for 65 and older. Well, at least one shot. We're close to 100%. So, I don't know what herd immunity that people have talked about, 70%? Well, we're over 70% of the adults with at least one shot, and we're almost there with fully vaccinated the adult fully vaccinated population. So I'm not sure what that number should be. We just need to get a lot of people to get the vaccine. Yes. Oh, sorry, go ahead.
We are seeing some other states that are requiring masking and also requiring proof of vaccination. Do you see that in our future within the next month or so?
No. You mean mandatory masking across the state? No. I mean, I think, when we talk about congregate care, the state has state stores, and the state also has driver's license centers. When you go into those, we'll have a sign up that says, please wear a mask. No one's going to make you wear it. Police aren't going to be there to enforce that. But I think what I've learned from growing up in Pennsylvania is that we care about each other. And you put that down, please wear a mask, that you'll do that to keep others safe. Yes.
Off topic, but your reaction to Governor Cuomo's resignation.
Well, I was one of the ones suggesting that he did that, so I think he did the right thing. Oh, another. And see, it's not raining anymore.
Of course.
No, related to that that previous question. I mean, as the governor said, our rates are pretty good, but we're seeing now a lot of spread in some very highly vaccinated areas. Now we're seeing that. So, I mean, what is your thought on the level that we need to get to really, to really stop this?
Yeah, certainly there's no highest perfect number for a vaccination rate, but knowing that the Delta variant is 1,000 times more transmissible, we have to do everything we can, everything that's possible to increase those vaccination rates as high as we possibly can. 80 is the number that's definitely been thrown out there, but certainly given the transmissibility, infected nature of the Delta variant, as well as those that are getting reinfected, we need to strive for as highest vaccination rates as we can.
To the full population?
That's correct.
One of the things, where are we having a huge outbreak? I mean, Pennsylvania's doing really well. I mean, some of the, yeah. Well, I don't know about Israel. Where, I'm not sure about where they've had. The ones that are the having the toughest time tend to be the ones that have had the worst records on vaccinations.
I think too that we're making 2,000 new cases today.
But again, Tuesday is a special day. That's why I think it's important to use the 14-day moving average.
So, and that was 7, right? Or no, 7 was the.
We're at 11. 7's the hospitalization rate. We are. Excuse me. Thank you for asking. I will.
12.
12.
Moving average,
Okay.
12 cases.
Yeah. Sorry, you had a question.
Yes. Is this vaccine incentive program designed in part to get more private industry on this bandwagon, offering either more incentives to get vaccines, or perhaps to even mandate the vaccines for them?
I'm not. It's not a mandate. I mean, I think private employers will do what they want to do. When I was a private employer 7 or 8 short years ago, or however long it was ago, we used to give a day off if you gave to the United Way, and it was a good incentive. We had a good record, and I have no reason to believe it won't work here. Other employers may have other ideas as to how to do this, but I think we all have a vested interest, as I said, in making sure we're safe. If you own a restaurant, you don't want patrons to feel uncomfortable coming to your restaurant. You don't want employees to feel uncomfortable coming to your restaurant. So you're going to do what you need to do to try to get them to be safe. And the best strategy, get the vaccine.
Any scenario under which you would mandate the vaccine for executive branch employees?
Mandate a vaccine, you mean make that?
Either condition of employment or subject them to the same, either you get a vaccine or...
well, I'm doing it here with the people who are giving... we can't do it with existing employees. But we've been working with human resources, and also the unions who represent state workers to make sure we do this in the right way. So if you want to work for the state, you have to get the vaccine. If you work here already, we're giving you a choice.
Is the day off something that you heard as something that would incentivize getting the vaccine, or what inspired this?
As what inspired it was that I did this for the United Way, and it worked really well.
Is there a cost to the Commonwealth for this and giving those days off?
Yeah, I mean, technically, I guess it's if you're a full-time employee, you get 8 hours off. So multiply your hourly rate by 8. We haven't calculated the cost. I don't. Have you calculated? Yes. Yeah, to make people feel safe to come back to work and show that we actually care about our employees. Absolutely. Just like the United Way, I'm not sure what we paid for that back in my company, but it was worth it in terms of just having people recognize relationship and the responsibilities they have to the communities that surround them. I don't know. Do we have any sense?
I can just add to that and say that this is part recognition for everyone who has done the right thing along the way. That's a big part of this. And the second part is, how do we draw attention to this and use the opportunity for further education for our employees who have not gotten vaccinated? We've been doing education efforts all along. We'll continue to do that. Maybe it'll get some more eyes on the things that we do send out. So it's part incentive and definitely recognition for the employees who have been vaccinated to get the reward for doing the right thing. Thank you.
Yes. Is this the last one?
For those employees who opt to get the COVID testing, the weekly testing, would they just have to do that on their own, go to like a CVS Rite Aid, or would they go somewhere else for that?
Read.
So you have to keep in mind that in a lot of these healthcare settings and congregate care settings, testing is not something that's new to them. Definitely this vaccination or test initiative is new. Most of the testing will be done at the facilities. We have a great partnership with Department of Health and our facility leaders in order to do that. So that's the plan right now. Most of it will happen within the facility on a weekly basis.
Does the employee have to pay for the test?
No, this is not a cost to the employee. We will use any test that's approved by the CDC, and it has a lot to do with the supply and what's available, and we'll partner with our colleagues at Department of Health to make sure that all the tests that are used and have been used continue to follow all the appropriate guidelines.
Okay. Thanks, everybody. Sorry about the rain. Not my fault.